If you've ever looked at your neck and thought, I have a lot of fullness here and I don't have a very strong chin, there's a couple of options for you. Sometimes it's the neck, but oftentimes it's because you don't really have much of a bony structure to push this out to really give yourself a nice shadow here. So a chin implant is sometimes a useful thing to think about, or these days chin filler is actually a really great option. Let's talk about it. So when it comes to addressing the chin, there's really two ways we can go about this. Number one is the easier way, where we're just using filler to bring out the soft tissue and make it look like the chin bone actually comes out a little further. That's pretty straightforward. Typically what I will do for patients is do one syringe at a time, where we'll just kind of see what one syringe looks like, let it settle for a couple weeks, and then follow up later and see if we need to do more. You can do a couple syringes if needed, if you really need a lot more projection, and that's fairly safe to do. The other option is a chin augmentation, where I make a little incision under the chin, and that incision heals super well, and we actually place an implant right here in this area. It sits right in front of a few layers and then on top of the bone. And basically what that does is it does exactly what a breast implant does, where it just provides structure, makes things look bigger. Unlike a breast implant, you do not need to get scans forever and really have things changed out down the road, or potentially the implant ruptures, things like that. That doesn't really happen with a chin implant. It's just a solid piece of silicone, and best case scenario, you just forget that it's there and you just look good forever. If you do get punched in the chin, or you're in a car accident, you hit your chin on something, is it possible to dislodge the implant? Yeah, it is possible, but that's pretty unlikely, and most of the time it just looks great. Both of those options are good options. Some people want to try the filler before they commit to a surgery just to see if they like how it looks. These days with morphing software and things like that, you can give a pretty good sense of what it will look like beforehand. So it's really up to you to talk to your surgeon about what you're interested in, and we'll help you get there.